Question 1. Risk assessment procedures indicate that a patient with moderate traumatic brain injury is exhibiting subtle, intermittent changes in their electroencephalogram EEG patterns, specifically brief periods of slowing and occasional epileptiform discharges. The patient's Glasgow Coma Scale (GCS) score remains stable, and there are no overt clinical signs of neurological deterioration. Given these findings, which of the following represents the most appropriate next step in neurophysiologic monitoring and management? Option A. Correlate the EEG findings with the patient's overall clinical status, including neurological examination, vital signs, and any available imaging, to determine the significance of the observed changes and guide further management decisions. Option B. Discontinue EEG monitoring until more significant clinical deterioration is observed, as the current findings are not overtly alarming. Option C. Immediately initiate prophylactic anticonvulsant medication based solely on the presence of epileptiform discharges, without further clinical correlation. Option D. Focus solely on the intermittent slowing on the EEG and recommend a change in sedation levels, disregarding the epileptiform discharges as potentially artifactual. Correct answer is A. Correlate the EEG findings with the patient's overall clinical status, including neurological examination, vital signs, and any available imaging, to determine the significance of the observed changes and guide further management decisions. Explanation. This scenario presents a professional challenge due to the critical nature of neurophysiologic monitoring in traumatic brain injury, TBI. The rapid and often unpredictable progression of TBI necessitates timely and accurate interpretation of monitoring data to guide clinical management and prevent secondary brain injury. The challenge lies in balancing the need for continuous vigilance with the potential for overinterpretation or misinterpretation of subtle changes, which could lead to unnecessary interventions or delayed appropriate care. CLTM certification emphasizes adherence to established protocols and best practices, ensuring that monitoring is conducted and interpreted within a defined, evidence-based framework. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based interpretation of neurophysiologic data in the context of the patient's overall clinical status. This aligns with the core principles of neurophysiologic monitoring, which demand that findings are not viewed in isolation, but are integrated with other clinical and imaging data. Regulatory frameworks for neurophysiologic monitoring, as expected for CLTM certification, mandate that practitioners operate within their scope of practice and adhere to established diagnostic and interpretive guidelines. This approach ensures patient safety by minimizing the risk of misdiagnosis or inappropriate treatment stemming from isolated or misinterpreted neurophysiologic signals. An incorrect approach that relies solely on a single abnormal neurophysiologic parameter without considering the broader clinical picture fails to meet the standards of professional practice. This could lead to a cascade of unnecessary interventions, increasing patient risk and healthcare costs, and potentially violating ethical obligations to provide evidence-based and patient-centered care. Another incorrect approach, which involves delaying interpretation or intervention due to uncertainty, can be equally detrimental in TBI, where time is a critical factor in mitigating secondary injury. This failure to act promptly on potentially significant findings could constitute a breach of professional duty and regulatory expectations for timely patient care. A third incorrect approach, focusing on a single modality of monitoring to the exclusion of others, ignores the comprehensive nature of neurophysiologic assessment in TBI, where multiple modalities often provide complementary information. This can lead to an incomplete understanding of the patient's condition and suboptimal management decisions, contravening the principles of thorough and integrated patient care. The professional decision-making process for similar situations should involve a structured approach. 1. Comprehensive data acquisition. Ensure all relevant neurophysiologic data is collected accurately and continuously. 2. Clinical correlation. Integrate neurophysiologic findings with the patient's neurological examination, vital signs, imaging results, and other relevant clinical information. 3. Interpretation within context. Analyze the neurophysiologic data in light of the specific TBI severity, mechanism of injury, and known physiological responses. 4. Communication and collaboration. clearly communicate findings and interpretations to the treating physician and other members of the care team. 5. Actionable recommendations. Provide clear, evidence-based recommendations for management based on the integrated assessment. 6. Continuous reevaluation. Recognize that the patient's condition can change rapidly and be prepared to reevaluate neurophysiologic data and clinical status accordingly. Question 2. Assessment of a patient undergoing long-term monitoring reveals focal slowing of cortical-evoked potentials in the somatosensory pathway. Considering the patient's history of a suspected lesion in the posterior limb of the internal capsule, which anatomical and physiological correlation is most critical for accurate interpretation of these findings? Option A. The integrity of the sensory cortex and its afferent pathways, specifically the dorsal column medial lemniscus pathway, and the impact of a lesion in the internal capsule on the transmission of sensory information to the cortex. Option B. The functional connectivity of the motor cortex and its efferent pathways, as motor deficits are often associated with sensory changes. Option C. The general excitability of the cerebral cortex and the typical latency ranges for all sensory modalities without specific regard to the affected pathway. Option D. The role of the cerebellum in motor coordination and proprioception, as disruptions here can manifest as sensory disturbances. The correct answer is A. The integrity of the sensory cortex and its afferent pathways, specifically the dorsal column medial lemniscus pathway, and the impact of a lesion in the internal capsule on the transmission of sensory information to the cortex. Explanation. Scenario analysis. This scenario presents a professional challenge in interpreting complex neurophysiological data in the context of a patient's underlying neurological condition. The challenge lies in accurately correlating observed electrophysiological patterns with specific anatomical structures and physiological processes of the nervous system, especially when subtle or atypical findings are present. This requires a deep understanding of neuroanatomy and physiology, coupled with the ability to integrate this knowledge with clinical presentation and diagnostic imaging. The professional must exercise careful judgment to avoid misinterpretation, which could lead to incorrect diagnoses or treatment plans. Correct approach analysis. The correct approach involves a systematic and integrated assessment that links the observed electrophysiological abnormalities to specific anatomical pathways and physiological functions within the nervous system. This aligns with best professional practice by ensuring that interpretations are grounded in established neuroscientific principles and are directly relevant to the patient's clinical picture. For CLTM certification, this demonstrates mastery of the core knowledge required to perform and interpret long-term monitoring, adhering to the implicit regulatory expectation of accurate and evidence-based practice. Incorrect approaches analysis. One incorrect approach would be to focus solely on the electrophysiological waveform morphology without considering the anatomical localization or physiological implications. This fails to meet the CLTM certification's requirement for a comprehensive understanding of the nervous system structure and function, potentially leading to misdiagnosis and violating the ethical obligation to provide accurate patient care. Another incorrect approach would be to overemphasize clinical symptoms without adequately correlating them with the electrophysiological findings and their anatomical basis. This neglects the critical role of neurophysiology in objective assessment and can lead to a superficial understanding of the patient's condition, deviating from the rigorous diagnostic standards expected in neurophysiology. A third incorrect approach might involve relying on generalized knowledge of nervous system function without specific consideration of the patient's unique anatomical variations or pathological processes. This lack of specificity can result in inaccurate interpretations and a failure to identify critical diagnostic clues, thereby not meeting the professional standards of care and the specific requirements of the CLTM certification. Professional reasoning. Professionals should approach such scenarios by first reviewing the patient's clinical history and any available imaging to establish a baseline understanding of the potential neurological deficits. Next, they should meticulously analyze the electrophysiological data, identifying any deviations from normal patterns. The crucial step is to then integrate these findings with their knowledge of neuroanatomy and physiology, hypothesizing which specific neural structures or pathways are likely affected. This iterative process of correlation and hypothesis testing, informed by both clinical and electrophysiological evidence, leads to the most accurate and clinically relevant interpretation. Question 3. Comparative studies suggest that understanding the precise anatomical location of lesions within the central nervous system is critical for accurate interpretation of neurophysiologic monitoring data. When evaluating a patient with suspected pontine tegmental lesions, which of the following anatomical considerations is most directly relevant to interpreting abnormalities in brainstem auditory evoked potentials, BEEP? Option A. The integrity of the visual pathways from the retina to the occipital cortex. Option B. The integrity of the cochlear nerve and its projections through the cochlear nuclei, superior olivary complex, lateral lemniscus, and inferior colliculus. Option C. The role of the cerebellum in motor coordination and balance. Option D. The functional connectivity between the precentral gyrus and the corticospinal tract. The correct answer is B. The integrity of the cochlear nerve and its projections through the cochlear nuclei, superior olivary complex, lateral lemniscus, and inferior colliculus. Explanation. Scenario analysis. This scenario presents a challenge for a CLTM professional by requiring them to interpret neurophysiologic data in the context of a patient's suspected central nervous system, CNS, pathology. The difficulty lies in correlating subtle electrophysiological findings with specific anatomical structures and their known functions, especially when the presentation is atypical or the lesion location is ambiguous. Accurate interpretation is paramount for guiding clinical management and treatment decisions, making a deep understanding of CNS anatomy and its functional representation in neurophysiology essential. Correct approach analysis. The correct approach involves a systematic evaluation of the electrophysiological findings, considering their origin within the CNS. This requires a thorough understanding of the anatomical pathways involved in generating the observed signals. For instance, if evoked potentials are abnormal, the professional must consider which sensory or motor tracts are likely affected based on the latency, amplitude, and morphology of the waveforms. Similarly, for EEG abnormalities, understanding the cortical and subcortical structures responsible for generating specific rhythms and their susceptibility to dysfunction is crucial. This approach aligns with best professional practice by ensuring that interpretations are grounded in established neuroanatomical and neurophysiological principles, directly supporting accurate diagnosis and patient care. Regulatory frameworks for CLTM emphasize the importance of accurate data interpretation and reporting, which inherently relies on a robust understanding of CNS anatomy and function. Incorrect approaches analysis, focusing solely on the electrophysiological waveform characteristics without considering the underlying neuroanatomy, is a significant failure. This approach risks misinterpreting the origin of the abnormality, leading to incorrect localization of the pathology. For example, attributing a generalized slowing in EEG to a focal cortical lesion without considering potential subcortical or brainstem involvement would be a critical error. Another incorrect approach is to rely on pattern recognition of waveforms without understanding the specific anatomical structures responsible for their generation. This can lead to oversimplification and misdiagnosis, particularly in complex cases. Furthermore, neglecting to integrate the patient's clinical presentation with the neurophysiological findings and anatomical considerations would be a failure to practice holistically, potentially leading to misdiagnosis and inappropriate treatment. These approaches violate the ethical obligation to provide competent and accurate neurophysiologic assessments, which are foundational to patient safety and effective healthcare delivery. Professional reasoning. Professionals should approach CLTM interpretation by first reviewing the patient's clinical history and suspected diagnosis. Then, they must systematically analyze the neurophysiologic data, constantly cross-referencing findings with their knowledge of CNS anatomy and the functional pathways involved. This involves considering the precise location of potential lesions and how they would manifest electrophysiologically. If evoked potentials are abnormal, the professional should trace the sensory or motor pathway from periphery to cortex, identifying the most likely site of disruption. For EEG, they should consider the anatomical basis of different brain rhythms and how specific lesions might affect their generation and propagation. This integrated approach, combining clinical information, electrophysiological data, and detailed anatomical knowledge, ensures the most accurate and clinically relevant interpretation. Question 4. The risk matrix shows a patient undergoing long-term EEG monitoring for suspected nonconvulsive status epilepticus. The technologist observes a sudden appearance of rhythmic, generalized delta activity with occasional sharp wave components, which is not present in the previous recordings and is not clearly attributable to artifact. The patient remains clinically obtunded. What is the most appropriate immediate next step for the technologist to take, based on the principles of neurophysiologic long-term monitoring? Option A. Consult with a colleague in the monitoring center to confirm the interpretation of the waveform before escalating to the physician. Option B. Continue monitoring and document the waveform changes, assuming they may resolve spontaneously without immediate clinical intervention. Option C. Immediately alert the attending physician to the new EEG findings and the patient's clinical status, requesting urgent clinical assessment and EEG review. Option D. Attempt to identify and eliminate potential artifact sources, such as electrode impedance issues or patient movement, before reporting the findings. The correct answer is C. Immediately alert the attending physician to the new EEG findings and the patient's clinical status, requesting urgent clinical assessment and EEG review. Explanation. Scenario analysis. This scenario presents a common challenge in neurophysiologic long-term monitoring, where subtle EEG waveform changes can have significant clinical implications. The professional challenge lies in accurately interpreting these waveforms in the context of a patient's clinical presentation and making timely, appropriate management decisions. Misinterpretation can lead to delayed or incorrect treatment, potentially impacting patient outcomes. The requirement to adhere strictly to CLTM exam guidelines means that the interpretation and subsequent actions must align with established neurophysiologic principles and best practices as defined within that framework, without introducing external or speculative interpretations. Correct approach analysis. The correct approach involves recognizing the specific EEG waveform, understanding its established significance within neurophysiologic monitoring, and correlating it with the patient's clinical status. For example, identifying a specific pattern like periodic lateralized discharges, PLD, or triphasic waves necessitates a thorough understanding of their association with conditions such as encephalitis, metabolic encephalopathy, or Creutzfeldt-Jakob disease. The CLTM framework emphasizes evidence-based interpretation and the importance of integrating EEG findings with clinical data to guide patient care. This approach represents best professional practice because it is systematic, evidence-based, and patient-centered, directly addressing the observed neurophysiologic changes with appropriate clinical consideration, as mandated by the CLTM standards. Incorrect approach is analysis. An incorrect approach would be to dismiss the observed waveform as artifact without a systematic evaluation of potential etiologies, or to overinterpret a benign waveform as pathological without sufficient clinical correlation. For instance, attributing a subtle slowing to patient movement without ruling out underlying cerebral dysfunction would be a failure to adhere to rigorous diagnostic principles. Another incorrect approach would be to recommend aggressive intervention based solely on a waveform pattern without considering the patient's overall clinical picture, potentially leading to unnecessary or harmful treatments. Such actions would violate the CLTM emphasis on accurate diagnosis, comprehensive assessment, and evidence-based decision-making, potentially leading to patient harm and professional misconduct. Professional reasoning. Professionals should approach such situations by first systematically analyzing the EEG for any deviations from baseline or expected patterns. This involves understanding the morphology, frequency, amplitude, and distribution of waveforms. Following this, the observed EEG findings must be critically evaluated in conjunction with the patient's history, current clinical status, and any other relevant investigations. This integrated approach ensures that interpretations are clinically relevant and actionable. Decision-making should be guided by established neurophysiologic literature and the specific protocols and guidelines relevant to the CLTM certification, prioritizing patient safety and optimal care. If uncertainty exists, consultation with a senior neurophysiologist or neurologist is a critical step in the decision-making process. Question 5. To address the challenge of determining the appropriate use of long-term neurophysiologic monitoring for a patient presenting with recurrent, transient neurological symptoms that are difficult to characterize, Which of the following approaches best aligns with the indications for monitoring as understood within the Certification in Neurophysiologic Long-Term Monitoring (CLTM) framework? Option A. Recommend long-term monitoring solely based on a broad suspicion of a neurological disorder, without specific symptom patterns or objective findings that strongly suggest the need for continuous electroencephalographic surveillance. Option B. Decline long-term monitoring if a single, brief electroencephalographic study does not reveal any abnormalities, assuming that any further monitoring would be redundant and unlikely to yield new information. Option C. Proceed with long-term monitoring after a comprehensive review of the patient's neurological examination, symptom description, and any available diagnostic data to ascertain if the symptoms meet established criteria for conditions that warrant prolonged electroencephalographic evaluation for diagnosis or management. Option D. Initiate long-term monitoring if the patient and their family express significant concern about the symptoms and their impact on daily life, even in the absence of clear electroencephalographic abnormalities on initial, shorter duration recordings. The correct answer is D. Initiate long-term monitoring if the patient and their family express significant concern about the symptoms and their impact on daily life, even in the absence of clear electroencephalographic abnormalities on initial, shorter duration recordings. Explanation. This scenario presents a professional challenge due to the need to balance patient benefit with resource utilization and adherence to established clinical guidelines for long-term neurophysiologic monitoring. The physician must critically evaluate the patient's presentation against the defined indications for such monitoring to ensure it is both medically necessary and ethically justified. The core of the challenge lies in discerning when the potential diagnostic or therapeutic value of prolonged monitoring outweighs the associated risks, costs, and patient burden, all within the framework of CLTM certification standards. The correct approach represents best professional practice because it directly aligns with the core principles of evidence-based medicine and the regulatory framework governing CLTM. By meticulously assessing the patient's symptoms, history, and neurological examination findings against the established indications for long-term monitoring, the physician ensures that the intervention is not only appropriate, but also likely to yield clinically significant information that cannot be obtained through less invasive or shorter duration methods. This adheres to the principle of medical necessity, a cornerstone of ethical practice, and often a requirement for reimbursement and quality assurance within healthcare systems that would recognize CLTM certification. An incorrect approach that relies solely on patient or family request without independent clinical justification fails to uphold the physician's professional responsibility to practice evidence-based medicine. This can lead to unnecessary procedures, increased healthcare costs, and potential patient harm from prolonged monitoring without clear benefit, violating ethical obligations to avoid harm and act in the patient's best interest. Another incorrect approach that prioritizes convenience or a broad, non-specific suspicion of seizure activity without specific supporting evidence overlooks the need for targeted diagnostic investigation. This can result in a fishing expedition that is inefficient and may expose the patient to risks without a clear diagnostic pathway, contravening the principles of judicious resource allocation and patient-centered care. Finally, an approach that dismisses the need for monitoring based on a single negative test, without considering the dynamic nature of certain neurological conditions or the limitations of specific diagnostic modalities, demonstrates a failure to apply a comprehensive clinical judgment, potentially delaying crucial diagnosis and treatment. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical presentation, a thorough review of their medical history, and a critical assessment of the potential benefits and risks of long-term monitoring. This process should be guided by current, evidence-based guidelines and the specific indications for neurophysiologic monitoring as recognized within the CLTM framework. Professionals should engage in shared decision-making with the patient and their family, ensuring they understand the rationale for monitoring, its potential outcomes, and any alternatives. Question 6. Stakeholder feedback indicates a recurring challenge where family members of patients undergoing neurophysiologic long-term monitoring sometimes attempt to limit the information provided to the patient regarding the procedure and its implications, believing they are acting in the patient's best interest. In such a situation, What is the most appropriate course of action for the neurophysiologic technologist? Option A. Proceed with the monitoring as planned, relying on the family member's assurance that they understand the procedure and will convey necessary information to the patient later. Option B. Politely but firmly explain to the family member that the patient has the right to full information and must be involved in the consent process, and then attempt to speak directly with the patient to obtain informed consent. Option C. Attempt to obtain consent from the patient without directly confronting the family member about their interference, hoping to avoid conflict. Option D. Immediately cease all monitoring activities and inform the referring physician that the family is obstructing the consent process without further engagement. The correct answer is B. Politely but firmly explain to the family member that the patient has the right to full information and must be involved in the consent process, and then attempt to speak directly with the patient to obtain informed consent. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the potential conflict between patient autonomy and the perceived best interests of the patient, as interpreted by a family member. The neurophysiologic technologist is tasked with obtaining informed consent for long-term monitoring, a procedure that requires the patient's understanding and voluntary agreement. The family member's insistence on withholding information, even if well-intentioned, directly impedes the technologist's ethical and regulatory obligation to ensure informed consent. The technologist must navigate this delicate situation by upholding professional standards while respecting the patient's right to information and decision-making capacity. Correct approach analysis. The correct approach prioritizes the patient's right to informed consent and upholds the technologist's professional duty to provide complete and accurate information. This aligns with the fundamental ethical principles of autonomy and beneficence, as well as regulatory frameworks that mandate informed consent for medical procedures. By directly addressing the family member and explaining the necessity of patient involvement in the consent process, the technologist asserts professional responsibility and seeks to rectify the situation by empowering the patient. This approach ensures that the patient, and not a surrogate, makes the decision about their own medical care, which is paramount in neurophysiologic monitoring, where patient cooperation is crucial for data integrity. Incorrect approaches analysis. One incorrect approach involves proceeding with the monitoring without obtaining the patient's explicit informed consent, relying solely on the family member's assurance. This is a significant regulatory and ethical failure. It violates the patient's right to autonomy and potentially exposes the technologist to legal repercussions for performing a procedure without proper authorization. It also undermines the trust inherent in the patient-provider relationship. Another incorrect approach is to defer entirely to the family member's wishes and abandon the monitoring procedure without attempting to engage the patient or explore alternative solutions. While respecting family involvement is important, the technologist has a primary duty to the patient. This approach fails to fulfill the technologist's professional obligation to provide necessary diagnostic services and could be seen as abandoning the patient's care without due diligence. A third incorrect approach is to attempt to subtly bypass the family member and obtain consent from the patient without informing the family member of this intention. While the ultimate goal is patient consent, this covert action can erode trust with the family and create further complications if discovered. It does not address the underlying issue of the family member's interference in a transparent and ethical manner. Professional reasoning. Professionals facing such dilemmas should first identify the core ethical principles at play, particularly patient autonomy and the duty to inform. They should then consult relevant professional guidelines and institutional policies regarding informed consent and surrogate decision-making. The decision-making process should involve clear communication, seeking to understand the family's concerns while firmly advocating for the patient's rights. If direct communication with the patient is not immediately possible or advisable due to the family's influence, escalating the situation to a supervisor, ethics committee, or the patient's physician for guidance is a crucial step in ensuring the best and most ethical outcome. Question 7. Process analysis reveals a neurophysiologist is reviewing long-term monitoring data for a patient with suspected demyelinating disease affecting multiple sensory pathways. The neurophysiologist has acquired visual evoked potentials, VEP, auditory evoked potentials, EEP, and somatosensory evoked potentials, CEP. Which of the following approaches best reflects the CLTM regulatory framework for interpreting this data to ensure comprehensive diagnostic accuracy? Option A. Conduct a thorough analysis of VEPs, EP, and SEPs, integrating the findings from each modality with the patient's clinical presentation to form a comprehensive diagnostic impression. Option B. Focus primarily on identifying and rejecting any artifacts within the VEP, EP, and SEP recordings, as artifact contamination is the most common cause of misinterpretation in long-term monitoring. Option C. Interpret the AEPs in isolation, as auditory pathways are often the earliest indicators of diffuse neurological dysfunction in demyelinating conditions. Option D. Prioritize the interpretation of VEPs as they are most sensitive to optic nerve involvement, and consider AEPs and SEPs only if VEPs are significantly abnormal. The correct answer is D. Prioritize the interpretation of VEPs as they are most sensitive to optic nerve involvement, and consider AEPs and SEPs only if VEPs are significantly abnormal. Explanation. This scenario is professionally challenging because it requires the neurophysiologist to interpret complex evoked potential data in the context of a patient's specific neurological condition and the evolving understanding of neurophysiological pathways. The challenge lies in accurately differentiating the contributions of various sensory modalities to the overall neurophysiological response, and ensuring that the interpretation aligns with established diagnostic criteria and best practices for long-term monitoring. Careful judgment is required to avoid misinterpreting artifacts or normal variations as pathological findings, which could lead to inappropriate clinical decisions. The correct approach represents best professional practice because it prioritizes a comprehensive and integrated interpretation of all available evoked potential data. By considering the visual evoked potentials, VEP, auditory evoked potentials, EP, and somatosensory evoked potentials, SEP, in conjunction with the patient's clinical presentation, the neurophysiologist can build a more complete picture of neurological function. This holistic approach is aligned with the principles of evidence-based practice and the ethical obligation to provide accurate and reliable diagnostic information. Specifically, the CLTM framework emphasizes the importance of correlating neurophysiological findings with clinical data to ensure the most accurate diagnosis and patient management. An incorrect approach that focuses solely on one type of evoked potential, such as only analyzing VEPs, would be a significant regulatory and ethical failure. This is because it ignores potentially crucial information from other sensory pathways that could be affected by the patient's condition. For instance, a patient with a brainstem lesion might have normal VEPs but abnormal AEPs and SEPs. Failing to assess all relevant evoked potentials would lead to an incomplete and potentially misleading diagnosis, violating the CLTM standard of care, which mandates thoroughness. Another incorrect approach might be to overemphasize artifact identification to the exclusion of genuine neurophysiological signals. While artifact rejection is critical, an excessive focus can lead to discarding valid data, resulting in a misdiagnosis. This would be a failure to meet the diagnostic accuracy expectations inherent in the CLTM certification. The professional reasoning process for similar situations should involve a systematic evaluation of all evoked potential modalities relevant to the patient's suspected condition. This includes understanding the specific neurophysiological pathways tested by VEPs, EP, and SEPs, and how they relate to different neurological structures. Professionals should always cross-reference their findings with the patient's clinical history, neurological examination, and other diagnostic investigations. Adherence to established CLTM protocols for data acquisition, processing, and interpretation is paramount. Furthermore, continuous professional development and staying abreast of the latest research in evoked potential interpretation are essential for maintaining competence and providing optimal patient care. Question 8. Strategic planning requires a comprehensive understanding of peripheral nervous system anatomy when interpreting electrophysiologic findings in a patient presenting with suspected nerve injury. Given a scenario where a patient exhibits motor weakness and sensory deficits in the hand, and electrophysiologic studies suggest involvement of a nerve in the forearm, which of the following analytical approaches best aligns with best professional practice for accurate diagnosis and patient management? Option A. Rely on the referring physician's initial assessment of the affected nerve, using electrophysiologic data primarily to confirm this diagnosis without independent anatomical verification. Option B. Conduct a thorough anatomical review of the forearm and hand, correlating electrophysiologic findings with the known branching patterns, sensory distributions, and potential entrapment sites of all relevant peripheral nerves in the region, considering anatomical variations. Option C. Focus solely on the electrophysiologic abnormalities, identifying the nerve based on the pattern of abnormal signals without detailed anatomical consideration of its course or potential variations. Option D. Prioritize electrophysiologic data interpretation, assuming the most common nerve pathway is affected, and proceed with treatment recommendations based on this assumption. The correct answer is D. Prioritize electrophysiologic data interpretation, assuming the most common nerve pathway is affected, and proceed with treatment recommendations based on this assumption. Explanation. Scenario analysis. This scenario presents a challenge in accurately interpreting neurophysiologic monitoring data, specifically in the context of a patient with a complex peripheral nerve injury. The difficulty lies in distinguishing between the effects of the primary injury and potential secondary complications, or misinterpretations of anatomical landmarks. Precise identification of the affected peripheral nerve and its anatomical course is paramount for accurate diagnosis and effective treatment planning, directly impacting patient outcomes. The professional challenge is to integrate anatomical knowledge with electrophysiologic findings to arrive at a definitive conclusion, avoiding assumptions that could lead to diagnostic errors. Correct approach analysis. The correct approach demonstrates best professional practice by systematically correlating the electrophysiologic findings with detailed anatomical knowledge of the peripheral nervous system. This involves not only identifying the likely nerve involved, but also considering its branching patterns, sensory and motor distributions, and potential entrapment sites. This meticulous approach ensures that the interpretation of nerve conduction studies and electromyography is grounded in a thorough understanding of the underlying anatomy, aligning with the CLTM certification's emphasis on accurate neurophysiologic assessment and the ethical obligation to provide precise diagnostic information. Incorrect approaches analysis. One incorrect approach would be to solely rely on the electrophysiologic data without a robust anatomical correlation. This fails to account for the possibility of atypical nerve branching or the involvement of multiple nerves, leading to a potentially incomplete or inaccurate diagnosis. This approach violates the principle of thoroughness in diagnostic evaluation and could result in misdirected treatment, contravening ethical standards of patient care. Another incorrect approach would be to make assumptions about the nerve's location based on superficial landmarks alone, without considering the deeper anatomical structures and potential variations. This oversimplification ignores the complexity of peripheral nerve anatomy and the potential for injury to affect nerves in ways not immediately apparent. Such an approach risks misidentifying the affected nerve, leading to incorrect localization of the pathology and potentially inappropriate interventions, which is a failure in professional due diligence. A further incorrect approach might involve attributing all abnormal findings to the most common nerve injury in the region, without considering less frequent but equally plausible anatomical variations or coexisting conditions. This diagnostic bias can lead to overlooking critical diagnostic clues and can result in a failure to identify the true cause of the patient's symptoms, thereby failing to meet the standard of care expected of a certified neurophysiologist. Professional reasoning. Professionals should approach such cases by first reviewing the patient's clinical presentation and history. This is followed by a detailed review of relevant anatomical texts and atlases to refresh knowledge of the specific peripheral nerve pathways in the affected region. The electrophysiologic data should then be meticulously analyzed, with each finding being mapped back to its anatomical correlate. Any discrepancies or ambiguities should prompt further investigation, such as considering alternative nerve pathways or potential entrapment sites. This iterative process of clinical correlation, anatomical review, and electrophysiologic interpretation ensures a comprehensive and accurate diagnostic assessment. Question 9. Consider a scenario where a patient presents with symptoms suggestive of a peripheral neuropathy, including numbness and tingling in the extremities. The referring physician requests an electrodiagnostic evaluation to confirm the diagnosis and assess the severity. As a certified neurophysiologic long-term monitoring professional, you are tasked with selecting the initial diagnostic approach. Option A. Recommend a nerve biopsy as the primary diagnostic tool. Option B. Begin with surface electromyography, (M), to assess nerve conduction velocities and muscle responses. Option C. Immediately proceed with needle EMG to directly evaluate individual muscle fiber activity. Option D. Rely solely on nerve conduction studies, NCS, without any EMG component. The correct answer is B. Begin with surface electromyography, (M), to assess nerve conduction velocities and muscle responses. Explanation. This scenario presents a professional challenge due to the need to select the most appropriate electrodiagnostic technique for assessing peripheral nerve function in a patient with suspected peripheral neuropathy, balancing diagnostic accuracy with patient comfort and invasiveness. The CLTM certification emphasizes adherence to established neurophysiologic monitoring standards and ethical practice. The correct approach, utilizing surface EMG, represents best professional practice because it is a non-invasive, generally well-tolerated method that can effectively screen for and characterize many types of peripheral neuropathies. It aligns with the principle of minimizing patient discomfort and risk while still providing valuable diagnostic information. Regulatory guidelines for neurophysiologic testing prioritize patient safety and the use of appropriate, validated techniques. An incorrect approach of solely relying on needle EMG without initial consideration of surface EMG would be professionally unacceptable. This is because needle EMG is an invasive procedure that carries inherent risks, such as infection, bleeding, and pain. It may not be necessary for initial diagnostic evaluation in all cases. Failing to consider less invasive options first could be seen as a deviation from best practice and potentially violate ethical considerations regarding patient well-being and informed consent, as a less invasive alternative exists. Another incorrect approach would be to dismiss surface EMG entirely based on a generalized assumption that it is insufficient for all neuropathy assessments. This overlooks the diagnostic utility of surface EMG in many common neuropathic conditions and could lead to unnecessary invasive procedures. Ethically, this represents a failure to apply current knowledge and best practices in neurophysiologic monitoring. A further incorrect approach would be to proceed with either technique without a clear understanding of the specific clinical question being addressed by the referring physician. This lack of clear communication and diagnostic intent can lead to suboptimal testing, misinterpretation of results, and potentially delayed or incorrect patient management, which is a failure in professional responsibility and adherence to diagnostic protocols. The professional decision-making process for similar situations should involve a thorough review of the patient's clinical history and the specific diagnostic question. This should be followed by an assessment of the available electrodiagnostic techniques, considering their invasiveness, risks, benefits, and diagnostic yield for the suspected condition. Consultation with the referring physician to clarify the diagnostic goals is crucial. The chosen technique should then be performed according to established protocols, with appropriate documentation and interpretation of findings. Question 10. The investigation demonstrates that a power surge occurred overnight in the neurophysiology department, affecting several LTM recording units. The technologist arrives for their shift and is immediately tasked with initiating long-term monitoring for a patient with a history of complex partial seizures. Before connecting the patient, the technologist notices that one of the LTM units displays a slightly different baseline impedance reading than usual, though the system appears to be otherwise operational. Considering the potential impact of the power surge on equipment integrity, which of the following actions is the most appropriate and compliant with CLTM certification standards? Option A. Visually inspect all cables and connections for obvious damage, and if none are found, proceed with monitoring, noting the impedance variation in the patient's chart. Option B. Immediately replace the affected LTM unit with a backup unit, without performing any further checks on either unit, to ensure no delay in patient monitoring. Option C. Proceed with patient monitoring on the unit, assuming the slight impedance variation is within acceptable tolerance and not indicative of a significant issue. Option D. Perform a full system diagnostic and artifact check on the affected LTM unit, and if it passes all validation parameters, proceed with patient monitoring. Correct answer is D. Perform a full system diagnostic and artifact check on the affected LTM unit, and if it passes all validation parameters, proceed with patient monitoring. Explanation. This scenario presents a professional challenge due to the critical nature of neurophysiologic long-term monitoring, LTM data integrity, and the potential for patient harm if equipment malfunctions or is improperly utilized. The technologist must balance rapid response to clinical needs with meticulous adherence to established protocols and equipment validation procedures. The core of the challenge lies in ensuring that the technology used accurately reflects the patient's neurophysiologic state without introducing artifacts or misinterpretations, which could lead to incorrect clinical decisions. The correct approach represents best professional practice because it prioritizes patient safety and data reliability through systematic validation and troubleshooting. Adhering to manufacturer guidelines and internal protocols for equipment checks ensures that the monitoring system is functioning optimally and that any detected anomalies are attributable to the patient's condition, not technical issues. This aligns with the ethical imperative to provide competent care and the regulatory expectation of maintaining accurate patient records and utilizing validated equipment. An incorrect approach that involves immediately proceeding with monitoring without verifying equipment functionality after a power surge is professionally unacceptable. This failure constitutes a breach of the duty of care, as it risks generating unreliable data. Such an action could violate regulatory guidelines that mandate the use of properly functioning and calibrated medical equipment. Furthermore, it demonstrates a lack of due diligence and a disregard for established safety protocols, potentially leading to misdiagnosis or inappropriate treatment. Another incorrect approach, such as relying solely on visual inspection of cables without performing a system diagnostic, is also professionally unsound. While visual checks are a component of equipment maintenance, they are insufficient to detect subtle internal malfunctions or software glitches that could impact data quality. This approach fails to meet the standard of care expected in neurophysiologic monitoring, where comprehensive testing is crucial. It may also contravene specific CLTM certification requirements that emphasize thorough equipment validation. A third incorrect approach, which involves assuming the equipment is functioning correctly because it was used successfully the previous day, ignores the potential impact of unforeseen events like power surges. This demonstrates a lack of critical thinking and a failure to adapt to changing circumstances. It overlooks the possibility that the surge may have caused latent damage or altered system parameters, thereby compromising the integrity of the monitoring. This approach is ethically questionable, as it prioritizes convenience over patient safety and data accuracy. The professional decision-making process for similar situations should involve a systematic, protocol-driven approach. When faced with potential equipment compromise, the technologist should first pause and assess the situation. This involves consulting manufacturer guidelines and institutional protocols for troubleshooting and validation. A thorough diagnostic check, including system self-tests and artifact evaluation, should be performed. If any doubt remains about the equipment's reliability, it should not be used for patient monitoring until fully validated or replaced. Communication with the supervising physician or neurologist about the equipment status and any potential impact on data is also paramount. This ensures transparency and collaborative decision-making regarding patient care. Question 11. Upon reviewing a patient's long-term monitoring data, a neurophysiologist is tasked with analyzing motor unit action potentials, MUAP, to assess for signs of neuromuscular disease. The data includes recordings of MUAP amplitude, duration, phase number, and shape. The neurophysiologist must determine the most appropriate method for interpreting these MUAP characteristics to contribute to an accurate diagnosis. Option A. Rely solely on the visual appearance of the MUAP, disregarding quantitative measurements and normative data. Option B. Focus primarily on the amplitude of the MUAP, as this is the most significant indicator of motor unit dysfunction. Option C. Make a preliminary diagnosis based on a quick visual scan of a few representative MUAP to expedite the reporting process. Option D. Systematically evaluate each MUAP parameter, amplitude, duration, phase number, shape, in conjunction with normative data and known pathological patterns to form a comprehensive interpretation. The correct answer is D. Systematically evaluate each MUAP parameter, amplitude, duration, phase number, shape, in conjunction with normative data and known pathological patterns to form a comprehensive interpretation. Explanation. This scenario is professionally challenging because it requires the neurophysiologist to interpret complex motor unit action potential, MUAP, data, which is fundamental to diagnosing neuromuscular disorders. The challenge lies in accurately differentiating between normal physiological variations and pathological changes that impact motor unit function, directly affecting patient diagnosis and management. Careful judgment is required to ensure the interpretation aligns with established neurophysiological principles and the specific requirements of the CLTM certification. The correct approach represents best professional practice because it involves a systematic and evidence-based method for analyzing MUAP parameters. This includes assessing amplitude, duration, phase number, and shape, and comparing these findings to normative data and known pathological patterns. This rigorous analysis ensures diagnostic accuracy and adherence to the standards expected for CLTM certification, which emphasizes a deep understanding of neurophysiological principles and their clinical application. This aligns with the ethical obligation to provide competent and accurate patient care. An incorrect approach that relies solely on visual inspection without quantitative analysis fails to meet the standards of a thorough neurophysiological assessment. This could lead to misinterpretation of subtle abnormalities, potentially resulting in an incorrect diagnosis or delayed treatment. Ethically, this represents a failure to exercise due diligence and apply the full scope of available diagnostic tools. Another incorrect approach that focuses only on a single MUAP parameter, such as amplitude, is insufficient. Motor unit function is multifactorial, and a comprehensive assessment requires evaluating multiple parameters. Ignoring other critical features like duration and shape can lead to overlooking significant pathological changes, thus failing to provide a complete diagnostic picture. This is a failure to adhere to best practices in neurophysiology and the standards of the CLTM certification. A further incorrect approach that prioritizes speed over accuracy by making a preliminary diagnosis based on limited data is professionally unacceptable. The CLTM certification requires a meticulous and comprehensive evaluation. Rushing the interpretation process, especially when dealing with the nuances of MUAP analysis, increases the risk of errors and can have serious consequences for patient care. This demonstrates a lack of commitment to the rigorous standards of the certification and the ethical imperative of accurate diagnosis. The professional decision-making process for similar situations should involve a structured approach. First, ensure all relevant data is collected and properly formatted. Second, systematically analyze each MUAP parameter against established normative values and known pathological characteristics. Third, integrate findings from multiple parameters to form a coherent interpretation. Fourth, cross-reference findings with clinical information. And finally, document the interpretation clearly and comprehensively, justifying the conclusions based on the neurophysiological evidence and relevant literature. This systematic process ensures accuracy, thoroughness, and adherence to professional and certification standards. Question 12. Compliance review shows that a neurophysiologic technician performing nerve conduction studies, NCS, consistently uses the same superficial stimulation point for the ulnar nerve at the elbow, regardless of patient anatomy or the clarity of the initial waveform. Which of the following represents the most appropriate professional approach to ensure accurate and reliable NCS data in this context? Option A. Rely solely on the technician's experience and intuition to determine the optimal stimulation site, without the need for systematic evaluation or adherence to specific anatomical landmarks. Option B. Continue using the established superficial stimulation point, assuming it is sufficient for most patients, and focus on documenting the findings without further investigation into alternative stimulation techniques. Option C. Systematically evaluate multiple stimulation sites around the elbow, including those that may be slightly more proximal or distal, to identify the point that elicits the largest and clearest compound muscle action potential, CMAP, or sensory nerve action potential, SNAP, while ensuring proper skin preparation and electrode contact. Option D. Increase the stimulation intensity at the existing site until a satisfactory waveform is obtained, even if it causes discomfort to the patient, to ensure a strong signal. The correct answer is C. Systematically evaluate multiple stimulation sites around the elbow, including those that may be slightly more proximal or distal, to identify the point that elicits the largest and clearest compound muscle action potential, CMAP, or sensory nerve action potential, SNAP, while ensuring proper skin preparation and electrode contact. Explanation. Scenario analysis. This scenario presents a challenge in ensuring the accuracy and reliability of nerve conduction study (NCS) data, which directly impacts patient diagnosis and treatment. The technician's reliance on a single, potentially suboptimal, stimulation site without considering anatomical variations or patient-specific factors introduces a risk of misinterpretation. The core challenge lies in balancing efficiency with the imperative to obtain clinically meaningful and reproducible results. Adhering to established best practices and regulatory expectations for neurophysiologic monitoring. Correct approach analysis. The correct approach emphasizes a systematic and thorough evaluation of nerve conduction. This involves selecting stimulation sites that are anatomically appropriate for the target nerve and considering potential variations in nerve pathways or superficiality. It also necessitates ensuring adequate skin preparation and electrode contact, which are fundamental to obtaining clear and artifact-free waveforms. This meticulous methodology aligns with the principles of good clinical practice and the implicit requirements for accurate data acquisition in neurophysiologic long-term monitoring, ensuring that the generated data is both reliable and clinically relevant for diagnostic purposes. Incorrect approaches analysis. One incorrect approach involves proceeding with a single stimulation site without verifying its optimal placement or considering alternatives. This can lead to inaccurate amplitude or velocity measurements if the stimulation is not effectively capturing the nerve's electrical activity, potentially resulting in a false negative or mischaracterization of a conduction abnormality. This failure to adhere to best practices in NCS technique can be considered a deviation from professional standards, potentially impacting patient care and leading to misdiagnosis. Another incorrect approach is to overlook the importance of proper electrode placement and skin preparation. Poor contact or inappropriate electrode positioning can introduce significant artifacts, such as electrical noise or volume conduction, which can distort the recorded waveforms. This compromises the integrity of the data, making it difficult or impossible to accurately interpret the nerve's electrical properties. Such a lapse in fundamental technique undermines the diagnostic value of the study and is contrary to the expected standards of care in neurophysiologic monitoring. A further incorrect approach might be to assume that a standard stimulation site is universally applicable without considering individual patient anatomy or potential pathology that might alter nerve accessibility. This rigid adherence to a protocol without critical assessment of the specific patient can lead to suboptimal data acquisition. It fails to acknowledge the variability inherent in human physiology and the need for adaptive techniques to ensure accurate assessment. Professional reasoning. Professionals in neurophysiologic long-term monitoring must adopt a decision-making process that prioritizes patient safety and diagnostic accuracy. This involves a continuous assessment of the acquired data, a thorough understanding of neuroanatomy and electrophysiology, and adherence to established protocols, while maintaining the flexibility to adapt techniques based on individual patient needs and the quality of the recorded signals. The process should involve critical evaluation of each step, from patient preparation to data acquisition and interpretation, ensuring that all actions are justifiable and contribute to a reliable diagnostic outcome. This proactive and critical approach is essential for maintaining professional competence and meeting regulatory expectations. Question 13. Examination of the data shows a patient presenting with suspected peripheral neuropathy. Which of the following neurophysiologic monitoring types is primarily designed to assess the electrical activity of skeletal muscles and the integrity of peripheral nerves? Option A. Electrooculography (EOG). Option B. Evoked potentials (EP). Option C. Electromyography (EM). Option D. Electroencephalography (EEG). The correct answer is C. Electromyography (EM). Explanation. This scenario presents a professional challenge due to the critical need to accurately identify and differentiate between various neurophysiologic monitoring modalities, each with distinct applications and technical requirements. Misidentification can lead to inappropriate selection of monitoring techniques, potentially compromising patient safety, diagnostic accuracy, and adherence to established clinical protocols within the neurophysiologic monitoring field. The CLTM certification emphasizes a thorough understanding of these distinctions to ensure competent practice. The correct approach represents best professional practice, because it demonstrates a comprehensive understanding of the fundamental differences between electroencephalography (EEG), electromyography (EMG), and evoked potentials. EEG specifically measures electrical activity in the brain, crucial for diagnosing conditions like epilepsy and sleep disorders. EMG assesses the electrical activity produced by skeletal muscles, vital for diagnosing neuromuscular disorders. EPs evaluate the integrity of sensory pathways by measuring the brain's electrical response to specific stimuli, used for assessing vision, hearing, and somatosensory function. This precise differentiation is essential for selecting the appropriate monitoring technique based on the clinical question and patient presentation, aligning with the standards of care and the scope of practice expected of a CLTM certified professional. An incorrect approach that fails to distinguish between these modalities would represent a significant regulatory and ethical failure. For instance, if a professional mistakenly believes that EEG can adequately assess peripheral nerve function, they would be violating established diagnostic protocols and potentially misdiagnosing or failing to diagnose critical conditions. This demonstrates a lack of fundamental knowledge, which is a direct contravention of the competency standards expected for CLTM certification. Furthermore, recommending or implementing an inappropriate monitoring technique based on such a misunderstanding could lead to patient harm, a breach of the duty of care, and potential legal ramifications. It also undermines the integrity of the neurophysiologic monitoring service and the trust placed in certified professionals. The professional decision-making process for similar situations should involve a systematic evaluation of the clinical context, the specific diagnostic question being asked, and the known capabilities and limitations of each neurophysiologic monitoring modality. A CLTM certified professional must first identify the suspected pathology or the system being investigated, brain, peripheral nerve, sensory pathway. Based on this, they should then recall the primary function of each monitoring type: EEG for brain activity, EMG for muscle activity, EPs for sensory pathway integrity. If there is any uncertainty, consulting relevant literature, established guidelines, or senior colleagues is a crucial step to ensure the most appropriate and effective monitoring strategy is chosen, thereby upholding both ethical obligations and regulatory requirements. Question 14. Performance analysis shows that a newly mandated safety protocol for neurophysiologic long-term monitoring, requiring specific patient positioning adjustments every 2 hours to prevent pressure sores and ensure optimal electrode contact, is encountering significant staff resistance due to concerns about disrupting patient sleep cycles and increasing workload. The clinical lead is considering a phased implementation, starting with only high-risk patients, or allowing staff discretion on the frequency of adjustments if patient comfort is perceived to be compromised. Which of the following represents the most appropriate course of action for the clinical lead to ensure compliance with safety standards and regulatory guidelines for neurophysiologic long-term monitoring? Option A. Postpone the full implementation of the new safety protocol until a more comprehensive training program can be developed and delivered, which may take several months. Option B. Implement the new safety protocol only for patients identified as high risk, with a plan to gradually extend it to other patients as staff become more accustomed to the workflow changes. Option C. Allow clinical staff to exercise discretion regarding the frequency of patient positioning adjustments, prioritizing perceived patient comfort over strict adherence to the 2-hour interval. Option D. Implement the new safety protocol immediately and comprehensively for all patients, while simultaneously initiating a review of workflow to identify and address any practical challenges in its execution. The correct answer is D. Implement the new safety protocol immediately and comprehensively for all patients, while simultaneously initiating a review of workflow to identify and address any practical challenges in its execution. Explanation: this scenario presents a common implementation challenge in neurophysiologic long-term monitoring, LTM, where a new safety protocol, designed to enhance patient well-being during prolonged monitoring, faces resistance due to perceived workflow disruption. The challenge lies in balancing the imperative of patient safety, a cornerstone of all healthcare regulations and ethical practice, with the practical realities of clinical workflow and staff efficiency. Professionals must navigate this tension by prioritizing patient welfare while seeking to integrate new protocols effectively. The correct approach prioritizes the immediate and comprehensive implementation of the new safety protocol, recognizing that regulatory compliance and patient safety are non-negotiable. This aligns with the fundamental principles of patient care and the explicit requirements of regulatory bodies governing CLTM, which mandate adherence to established safety standards to prevent harm. Best professional practice dictates that any new protocol designed to improve safety must be adopted without delay, with subsequent efforts focused on optimizing its integration into existing workflows. This proactive stance ensures that patients receive the highest standard of care and that the facility remains compliant with all relevant guidelines. An incorrect approach that delays or selectively implements the protocol fails to uphold the primary duty of care to patients. This could lead to adverse events that the protocol was designed to prevent, resulting in potential patient harm and regulatory noncompliance. Ethically, it demonstrates a disregard for established safety measures. Another incorrect approach that attempts to bypass or significantly alter the protocol without proper validation or approval from relevant oversight bodies is also professionally unacceptable. This undermines the integrity of the safety framework and could introduce new, unforeseen risks. Such actions would likely violate specific guidelines related to protocol implementation and patient safety within the CLTM framework. The professional decision-making process in such situations should involve a thorough understanding of the new protocol's rationale and its regulatory basis. When faced with resistance, professionals should engage in open communication, emphasizing the patient's safety benefits and the regulatory mandate. If workflow issues arise, the focus should be on collaborative problem-solving to adapt the workflow to the protocol, rather than compromising the protocol itself. This involves seeking input from the clinical team to identify practical solutions that maintain both safety and efficiency, always deferring to the established safety standards and regulatory requirements. Question 15. Compliance review shows that a patient presents with symptoms suggestive of a mild peripheral neuropathy affecting the hands. The neurophysiologist is considering the most appropriate initial electromyography (EM) approach. Which of the following approaches best aligns with the principles of electromyography and patient-centered care in this context? Option A. Proceeding directly to a motor unit potential analysis of proximal limb muscles to assess for early signs of motor neuron disease. Option B. Conducting nerve conduction studies, NCS, of the median, ulnar, and radial nerves in the upper extremities to assess nerve function and identify potential sites of conduction block or slowing. Option C. Recommending a single-fiber EMG study to evaluate for disorders of neuromuscular transmission. As this is a highly sensitive technique, Option D. Performing a comprehensive needle EMG examination of multiple muscles in both the upper and lower extremities to rule out a broad range of neuromuscular disorders. The correct answer is D. Performing a comprehensive needle EMG examination of multiple muscles in both the upper and lower extremities to rule out a broad range of neuromuscular disorders. Explanation: scenario analysis. This scenario presents a common challenge in neurophysiologic long-term monitoring, ensuring the accurate and ethical application of electromyography (EMG) principles in a clinical setting. The challenge lies in balancing the need for comprehensive diagnostic information with patient safety and the integrity of the monitoring process. Misapplication of EMG techniques can lead to misdiagnosis, unnecessary patient discomfort, and potential legal or regulatory repercussions. The professional must exercise careful judgment to select the most appropriate EMG approach based on the patient's condition and the specific diagnostic question. Correct approach analysis. The correct approach involves selecting an EMG technique that directly addresses the suspected neuromuscular pathology while adhering to established clinical guidelines and patient safety protocols. This aligns with the core principles of neurophysiologic monitoring, which emphasize accurate data acquisition and interpretation. Specifically, choosing a technique that minimizes invasiveness while maximizing diagnostic yield is paramount. This reflects best professional practice by prioritizing patient well-being and the generation of reliable diagnostic information, thereby upholding the standards expected for certification in neurophysiologic long-term monitoring, CLTM. Regulatory frameworks for medical practice, including those governing neurophysiologic monitoring, mandate that procedures are performed competently and ethically, with patient welfare as the primary concern. Incorrect approach is analysis. An incorrect approach would involve selecting an EMG technique that is either overly invasive for the diagnostic question, potentially causing undue patient distress or risk, or a technique that is insufficient to provide the necessary diagnostic information, leading to incomplete or inaccurate assessments. For instance, employing a more aggressive needle EMG examination when a nerve conduction study, NCS, alone would suffice for a suspected peripheral neuropathy represents a failure to adhere to the principle of least harm and potentially violates guidelines regarding appropriate use of diagnostic procedures. Conversely, relying solely on NCS when a specific muscle assessment via needle EMG is indicated for suspected myopathy would lead to a diagnostic gap, failing to meet the professional obligation to thoroughly investigate the patient's condition. Such deviations from best practice can be considered regulatory or ethical failures, as they compromise patient care and the integrity of the diagnostic process. Professional reasoning. Professionals in neurophysiologic long-term monitoring should employ a systematic decision-making process when selecting EMG techniques. This process begins with a thorough review of the patient's clinical history, symptoms, and the specific diagnostic question. Next, they should consider the available EMG modalities and their respective indications, contraindications, and potential risks. The decision should then be made to select the technique that offers the highest diagnostic value with the lowest risk to the patient, in accordance with established CLTM guidelines and relevant medical practice regulations. Continuous professional development and adherence to ethical codes are essential to navigate these complex clinical decisions effectively. Question 16. Analysis of the optimal strategy for selecting EEG montages during long-term monitoring, considering the need to balance comprehensive data acquisition with patient comfort and signal integrity, in the context of the certification in neurophysiologic long-term monitoring, CLTM, regulatory framework. Option A. Systematically evaluate the clinical question and patient factors to select a primary montage that provides optimal coverage of suspected epileptogenic zones, with the flexibility to add or modify secondary montages based on real-time observations of signal quality and potential artifact. Option B. Consistently utilize a standard 10-20 system montage for all patients undergoing long-term monitoring, as this is the universally accepted baseline for neurophysiologic assessments. Option C. Rely on the most frequently used montage from previous studies on similar patient populations, assuming it will be sufficient for the current case. Option D. Prioritize the use of montages that minimize the number of electrodes to reduce application time and patient discomfort, even if it means sacrificing some spatial resolution. The correct answer is A. Systematically evaluate the clinical question and patient factors to select a primary montage that provides optimal coverage of suspected epileptogenic zones, with the flexibility to add or modify secondary montages based on real-time observations of signal quality and potential artifact. Explanation. This scenario presents a common challenge in neurophysiologic long-term monitoring, optimizing EEG montage selection for accurate and efficient data acquisition while adhering to established protocols and patient needs. The professional challenge lies in balancing the need for comprehensive data coverage with the practicalities of patient comfort, signal quality, and the potential for artifact. Careful judgment is required to select the most appropriate montage that maximizes diagnostic yield without introducing unnecessary complexity or compromising data integrity. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based method for montage selection. This involves understanding the clinical question, the patient's specific condition, and the strengths and limitations of different electrode configurations. Adherence to established guidelines for electrode placement and montage selection, as mandated by the certification in neurophysiologic long-term monitoring, CLTM, framework, ensures consistency, reproducibility, and diagnostic accuracy. This approach minimizes the risk of missing critical epileptiform activity or misinterpreting artifacts, thereby directly contributing to patient safety and effective clinical management. An incorrect approach that relies solely on historical precedent, without reevaluation, fails to adapt to evolving clinical needs or technological advancements. This can lead to suboptimal data acquisition, potentially missing subtle abnormalities or generating excessive artifact that obscures important findings. Ethically, this represents a failure to provide the highest standard of care. Another incorrect approach, focusing exclusively on a single type of montage regardless of the clinical context, demonstrates a lack of critical thinking and an inability to tailor the monitoring strategy to the individual patient. This can result in inefficient data collection and a reduced likelihood of achieving the diagnostic goals. Regulatory failure here stems from not applying the principles of evidence-based practice and failing to meet the comprehensive data acquisition standards expected within the CLTM framework. A third incorrect approach, prioritizing speed over thoroughness in electrode placement and montage selection, directly compromises data quality. This can lead to misinterpretations and diagnostic errors, posing a significant risk to patient care and violating the ethical obligation to ensure accurate neurophysiologic assessments. The professional reasoning process for similar situations should involve a thorough understanding of the clinical indication for LTM, a review of the patient's history and any known neurological conditions, and a critical evaluation of the available montage options. This includes considering the specific brain regions of interest, the potential for artifact generation, e.g., patient movement, muscle activity, and the need for both longitudinal and transverse bipolar derivations. The decision-making process should be guided by established CLTM protocols and best practices, ensuring that the chosen montage is appropriate for the diagnostic task and maximizes the chances of capturing relevant neurophysiologic events. Question 17. The control framework reveals that when interpreting evoked potential results during long-term neurophysiologic monitoring, a clinician encounters a subtle but persistent alteration in waveform morphology. This alteration is not a complete absence of a response, nor is it a dramatic latency shift, but rather a change in the shape of the waveform that is not immediately attributable to common artifacts. The clinician must decide on the most appropriate interpretive approach. Option A. Attribute the morphological change to inherent variability in neurophysiologic signals, and conclude that no further investigation or interpretation is warranted without more pronounced changes. Option B. Immediately classify the altered waveform as indicative of a significant neurological event, and recommend immediate clinical intervention based on this finding alone. Option C. Focus exclusively on identifying whether the altered waveform deviates from a standard normative database for the specific evoked potential modality, disregarding the patient's individual history and current clinical status. Option D. Prioritize a detailed comparison of the current waveform morphology against the patient's baseline recordings, and concurrently evaluate any recent clinical changes or physiological fluctuations that could influence the evoked potential. The correct answer is D. Prioritize a detailed comparison of the current waveform morphology against the patient's baseline recordings, and concurrently evaluate any recent clinical changes or physiological fluctuations that could influence the evoked potential. Explanation. The control framework reveals that interpreting evoked potential EP results in neurophysiologic long-term monitoring, NLTM, requires a nuanced understanding of both the electrophysiological data and the patient's clinical context. This scenario is professionally challenging because EP waveforms are dynamic and can be influenced by numerous factors beyond the primary neurological condition being monitored. Distinguishing between true pathological changes and transient physiological variations or artifacts demands rigorous analytical skills and adherence to established diagnostic criteria. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted interpretation that integrates objective EP findings with subjective clinical observations and the patient's known medical history. This aligns with the ethical imperative to provide accurate and individualized patient care, minimizing diagnostic errors and ensuring appropriate treatment decisions. Regulatory guidelines for NLTM, such as those governing the certification in neurophysiologic long-term monitoring, CLTM, emphasize the importance of correlating electrophysiological data with clinical presentation to ensure the validity and utility of the monitoring. An incorrect approach that focuses solely on the presence or absence of specific waveform components without considering the clinical context is professionally unacceptable. This can lead to misdiagnosis, unnecessary intervention or delayed treatment. Such an approach fails to meet the standard of care expected in neurophysiology and may violate ethical principles of beneficence and non-maleficence by potentially causing harm through incorrect interpretation. Furthermore, it disregards the regulatory requirement for thorough and context-aware analysis, which is fundamental to the CLTM certification. Another incorrect approach that relies on comparing current EP results to a generalized normative database without accounting for individual patient variability or potential confounding factors is also flawed. While normative data provides a baseline, individual neurophysiology can deviate significantly. Ignoring these deviations and the specific clinical situation can lead to misinterpretations. This approach lacks the individualized assessment crucial for effective patient management and may not satisfy the detailed reporting requirements mandated by regulatory bodies overseeing neurophysiologic monitoring. The professional decision-making process for similar situations should involve a systematic evaluation. First, meticulously review the raw EP data for technical quality and potential artifacts. Second, analyze the morphology, latency, and amplitude of the waveforms, comparing them to previous recordings from the same patient and cautiously to normative data. Third, critically assess the patient's current clinical status, including any changes in medication, physiological state e.g., alertness, temperature, or neurological symptoms. Finally, synthesize all this information to form a coherent interpretation that is directly relevant to the patient's clinical management. This integrated approach ensures that the EP interpretation is both scientifically sound and clinically actionable, fulfilling the highest professional and regulatory standards. Question 18. Quality control measures reveal that a neurophysiologic technologist has consistently reported NCS findings as clinically significant solely based on deviations from established normative values, without detailed correlation to the patient's reported symptoms or physical examination findings. Which of the following represents the most appropriate course of action for addressing this quality control issue within the CLTM framework? Option A. Provide immediate retraining to the technologist focusing on the critical importance of integrating NCS results with comprehensive clinical data, emphasizing that isolated statistical deviations are not inherently clinically significant without context. Option B. Document the deviation in the technologist's file and schedule a follow-up review in 6 months, assuming the issue may resolve with time and experience. Option C. Advise the technologist to cease performing NCS until a full review of their past reports is completed, without providing immediate corrective guidance. Option D. Implement a policy requiring all NCS reports to include a disclaimer stating that findings are based solely on normative value comparisons and do not constitute a clinical diagnosis. The correct answer is A. Provide immediate retraining to the technologist focusing on the critical importance of integrating NCS results with comprehensive clinical data, emphasizing that isolated statistical deviations are not inherently clinically significant without context. Explanation. Scenario analysis. This scenario presents a common challenge in neurophysiologic long-term monitoring, interpreting subtle or equivocal nerve conduction study, NCS findings in the context of patients' overall clinical presentation. The difficulty lies in distinguishing between clinically significant abnormalities that warrant intervention or further investigation and findings that are either within normal limits for the individual, transient, or not directly attributable to a pathological process impacting the patient's symptoms. Misinterpretation can lead to unnecessary patient anxiety, inappropriate treatment, or delayed diagnosis of a critical condition. Correct approach analysis. The correct approach emphasizes integrating NCS findings with the complete clinical picture, including patient history, physical examination, and other diagnostic data. This aligns with the fundamental principles of medical practice and the ethical obligation to provide patient-centered care. Specifically, for the certification in neurophysiologic long-term monitoring, CLTM. This approach is supported by the overarching regulatory framework that mandates competent and comprehensive patient assessment. The CLTM certification implicitly requires practitioners to demonstrate the ability to synthesize complex data, not just report isolated test results. Best professional practice dictates that diagnostic tests serve to clarify clinical questions, not to dictate management in isolation. Incorrect approach is analysis. An approach that solely focuses on identifying any deviation from a standard reference range without considering the clinical context is professionally unacceptable. This fails to acknowledge individual variability and the potential for non-pathological findings to appear abnormal in a statistical sense. Ethically, it can lead to overdiagnosis and overtreatment, violating the principle of do no harm. Regulatory frameworks for medical professionals, including those governing CLTM, implicitly require clinical correlation. Another incorrect approach is to dismiss NCS findings entirely if they do not perfectly correlate with the most suspected diagnosis. While clinical correlation is paramount, NCS can reveal unexpected or alternative diagnoses. Ignoring potentially significant findings, even if they don't fit the initial hypothesis, can lead to misdiagnoses and delayed appropriate care, which is a failure of professional responsibility and potentially a breach of regulatory standards for diagnostic accuracy. Finally, an approach that prioritizes the most dramatic or statistically significant NCS abnormality without considering its clinical relevance to the patient's presenting symptoms is also flawed. This can lead to a focus on incidental findings rather than the primary clinical problem, potentially diverting resources and attention from the most impactful diagnostic and therapeutic pathways. This approach neglects the core purpose of diagnostic testing: to inform clinical decision-making regarding the patient's specific condition. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the patient's history and physical examination. This forms the basis for formulating differential diagnoses and identifying specific clinical questions that NCS can help answer. When interpreting NCS results, practitioners must critically evaluate each finding in light of the clinical context, considering the sensitivity and specificity of the test for the suspected conditions. They should then synthesize all available information to arrive at a diagnosis or to guide further investigation, always prioritizing the patient's well-being and the most accurate and efficient path to diagnosis and treatment. Question 19. Research into the impact of a novel artifact detection algorithm on the diagnostic accuracy of long-term EEG recordings for epilepsy monitoring, considering its integration into the CLTM workflow, prompts a review of interpretation protocols. Which of the following approaches best reflects the required standard of care and regulatory compliance for interpreting the EEG data following the implementation of this new algorithm? Option A. The interpretation should be conducted by the software developer of the artifact detection algorithm, without direct involvement of a CLTM-certified neurophysiologist, to ensure unbiased assessment of the algorithm's performance. Option B. The interpretation should focus exclusively on identifying seizure events, as flagged by the artifact detection algorithm, and disregard any other EEG abnormalities or the patient's clinical history if it does not directly correlate with a flagged event. Option C. The interpretation should involve a comprehensive review of the entire EEG recording, with the new artifact detection algorithm used as a supplementary tool to flag potential issues, but final diagnostic conclusions must be based on expert neurophysiologist review and correlation with the patient's clinical presentation. Option D. The interpretation should primarily rely on the output of the new artifact detection algorithm, assuming its accuracy is high, with minimal manual review of the raw EEG data to expedite reporting turnaround times. The correct answer is C. The interpretation should involve a comprehensive review of the entire EEG recording, with the new artifact detection algorithm used as a supplementary tool to flag potential issues, but final diagnostic conclusions must be based on expert neurophysiologist review and correlation with the patient's clinical presentation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of long-term EEG monitoring in diagnosing and managing neurological conditions. The interpretation of EEG data requires a high degree of expertise, and the potential for misinterpretation carries significant implications for patient care, including delayed diagnosis, inappropriate treatment, and potential harm. The challenge lies in balancing the need for timely and accurate interpretation with the inherent complexities and potential ambiguities in EEG signals, all while adhering to stringent regulatory standards for patient safety and data integrity. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based review of the entire EEG recording, correlating findings with the patient's clinical history and any concurrent events. This aligns with best professional practice as it ensures a comprehensive and contextually relevant interpretation. Regulatory frameworks, such as those governing medical device usage and professional conduct in neurophysiology, mandate that interpretations be thorough, accurate, and based on established diagnostic criteria. Ethical considerations also dictate that patient well-being is paramount, requiring a diligent and unbiased assessment of all available data to arrive at the most accurate diagnosis and treatment recommendations. Incorrect approaches analysis. One incorrect approach involves focusing solely on identifying a single, prominent abnormal waveform without considering the broader context of the EEG or the patient's clinical presentation. This fails to meet regulatory requirements for comprehensive diagnostic evaluation and can lead to overdiagnosis or misdiagnosis. Ethically, it breaches the duty of care by providing an incomplete and potentially misleading assessment. Another incorrect approach is to rely primarily on automated analysis software without independent expert review. Software can be a useful tool. Regulatory guidelines and professional standards typically require human oversight and validation of automated findings. Over-reliance on automation without critical human judgment can lead to the acceptance of false positives or negatives, compromising patient safety and violating professional accountability. A third incorrect approach is to interpret the EEG in isolation, disregarding the patient's reported symptoms, medications, or other relevant clinical information. This violates the principle of holistic patient care and can result in interpretations that are technically correct in isolation, but clinically irrelevant or misleading. Regulatory bodies expect practitioners to integrate all available information for a complete diagnostic picture, and ethical practice demands that patient-specific factors guide interpretation. Professional reasoning. Professionals should approach EEG interpretation with a structured methodology. This involves 1. Thoroughly reviewing the patient's clinical history and the reason for the EEG. 2. Systematically examining the entire EEG recording, paying attention to all electrode sites and epochs, noting both normal and abnormal patterns. 3. Correlating EEG findings with any documented clinical events or patient-reported symptoms during the recording. 4. Considering the impact of medications, sleep state, and other physiological factors on the EEG. 5. Utilizing automated tools as aids, but always applying independent clinical judgment and expertise to validate findings. 6. Documenting the interpretation clearly, including the rationale for conclusions and any limitations. This systematic and integrated approach ensures adherence to regulatory standards, upholds ethical obligations, and promotes optimal patient outcomes. Question 20. The performance metrics show a patient undergoing long-term monitoring for suspected focal epilepsy. During a recorded event, electrographic activity with sharp waves and subsequent rhythmic theta activity is observed originating from the left temporal lobe electrodes, correlating with the patient reporting a sensation of déjà vu and a rising epigastric feeling. Considering the established functional neuroanatomy of the central nervous system, which of the following interpretations most accurately reflects the likely anatomical origin and propagation of the seizure activity? Option A. The seizure activity originates from the frontal lobe, specifically the prefrontal cortex, and is associated with executive dysfunction. Option B. The seizure activity is indicative of a generalized seizure originating from the thalamocortical network, affecting widespread cortical areas. Option C. The seizure activity likely originates from the mesial temporal lobe structures, such as the hippocampus or amygdala, consistent with the reported autonomic and experiential symptoms. Option D. The seizure activity is diffuse and bilateral, suggesting a diffuse cortical dysfunction without a specific focal origin. Correct answer is C. The seizure activity likely originates from the mesial temporal lobe structures, such as the hippocampus or amygdala, consistent with the reported autonomic and experiential symptoms. Explanation. Scenario analysis. This scenario presents a professional challenge where a neurophysiologist must interpret long-term monitoring data in the context of a patient's suspected seizure disorder. The challenge lies in accurately correlating electrographic findings with clinical events, which requires a precise understanding of central nervous system, CNS, anatomy, and the functional implications of electrical activity in different brain regions. Misinterpreting the anatomical origin of seizure activity can lead to incorrect localization, potentially impacting treatment decisions and patient outcomes. The need for absolute priority in adhering to the CLTM regulatory framework means that all interpretations and actions must be grounded in established protocols and guidelines specific to this certification. Correct approach analysis. The correct approach involves systematically evaluating the electrographic seizure onset and spread patterns in relation to known CNS anatomical structures and their respective functions. This aligns with best professional practice by ensuring that the interpretation is anatomically sound and clinically relevant. By identifying the likely origin and propagation pathways, the neurophysiologist can provide accurate information for further diagnostic workup or therapeutic intervention, directly supporting the patient's care plan within the CLTM framework. This methodical approach minimizes diagnostic error and upholds the standards of care expected of a CLTM-certified professional. Incorrect approaches analysis. One incorrect approach would be to focus solely on the amplitude and frequency of the electrographic discharges without considering their spatial distribution and relationship to specific cortical or subcortical structures. This fails to acknowledge the critical role of CNS anatomy in localizing seizure origins and can lead to a generalized, unhelpful interpretation. This approach risks violating CLTM guidelines that emphasize precise localization for effective patient management. Another incorrect approach would be to attribute the seizure activity to a broad, nonspecific brain region without attempting to pinpoint a more precise anatomical locus. This lacks the diagnostic rigor required for effective seizure management and may overlook subtle but crucial anatomical clues that could guide treatment. Such an approach would be considered a failure to meet the professional standards of detailed neurophysiological analysis mandated by the CLTM certification. A further incorrect approach would be to disregard the clinical semiology reported by the patient or caregivers and rely exclusively on the electrographic data. While electrography is paramount, its interpretation is most valuable when integrated with clinical observations. Failing to correlate electrographic events with observable symptoms, which are often linked to specific functional areas of the CNS, represents a significant oversight and a departure from comprehensive neurophysiological assessment, potentially contravening CLTM principles of holistic patient evaluation. Professional reasoning. Professionals should adopt a systematic, anatomically informed approach to interpreting LTM data. This involves 1. Meticulously reviewing the electrographic seizure onset and evolution, noting the specific electrode locations showing initial abnormalities. 2. Correlating these electrographic findings with the patient's reported clinical symptoms and observed behaviors during the seizure events. 3. Integrating this information with a detailed understanding of CNS functional anatomy, considering the known roles of different brain regions in generating and propagating electrical activity. And 4. Documenting the interpretation with clear anatomical localization and a rationale based on the observed electrographic and clinical patterns, adhering strictly to CLTM reporting standards.